So welcome back, everybody. Why don't you get settled? We're about to launch our next part of the program, but we had a request to let you know how many different countries are represented in the room here today. And that would be, I believe, 23 countries. I'm just going to read them very, very quickly because I think it's striking. With the microphone, anyway. Hong Kong, Bangladesh, Philippines, Myanmar, Thailand, China, India, US, Canada, UK, Malaysia, Brunei, Tanzania, Laos, Pakistan, Australia, South Africa, Netherlands, Colombia, Chile, Brazil, Switzerland, and Kenya. So I think we have a very diverse group here today. And now I'm going to turn it over to the next panel. And Nirmala is going to return to lead this group.
Good afternoon. I'm very happy to tell you that we're about to start session 4. And session 4 is entitled Issues in Program Development, Implementation, and Sustainability. And the goal of this session is to identify methods, measures, and outcomes of costing and financing service integration within existing platforms. We have 3 speakers who will speak to issues related to program development, implementation, and sustainability, respectively. So it gives me great pleasure to introduce our first speaker, Dr. Emma Pearson, who's a senior lecturer at the University of Brunei Darussalam.
Good afternoon, everybody. I'd like to thank the organisers for giving me the opportunity to participate in this forum and to share the room with so many esteemed international scholars and practitioners. And so in my presentation, I am aiming to provide a very, very brief overview of the situation of early childhood care and education in the region. And I should make my first correction. That should read Southeast Asia and the Pacific region. With particular reference to the way that the Millennium Development Goal and Education for All targets have shaped ECCE in the region over the past couple of decades, and also opportunities offered by the proposed Sustainable Development Goals in terms of moving forward. And I should be able to get through this very quickly because I'm actually making similar points to those that have been raised earlier in the day, but I guess it's slightly different because it's from a regional perspective. So the key points I would... Key points I would like to make are that much has been achieved in the region, largely due to impetus from the Millennium Development Goal targets and EFA. But we have much still to do, specifically in terms of ensuring that our services, our provision, cater for children from diverse contexts so that we're producing equitable services. Also in terms of sustainability, because many of the early childhood care and education programs in the region are still heavily dependent on INGO funding. The second point I'd like to make is in relation to the nature of the Millennium Development Goal targets, which, because they were largely very quantitative and fairly globalized in nature, have kind of diverted our attention away from the very complex localized issues of providing early childhood care and education. And this is an argument that's made not only in relation to early childhood, but also in the broader human development literature as well. And then the final point that I'd like to make is actually the proposed post-2015 Sustainable Development Goal pose a challenge to us, and that is that we need to start engaging much more with very complex, localized issues that are involved, particularly in terms of ensuring that we're providing equitable access to early childhood care and education. So the UN Secretary General's recent report entitled The Road to Dignity refers to the importance of a truly transformative agenda that's both universal and adaptable to the conditions of each country. And I would take that further to argue that it should be adaptable to the conditions of very diverse communities and contexts as well. And that places people and planet right at the center. So many of these statistics, I'm sure most of you are very familiar with. As I mentioned, we've made some very impressive improvements in pre-primary enrollment rates. Our infant and maternal mortality rates have decreased. And there have been other broader positive outcomes in terms of greater regional knowledge dissemination, the establishment and development of some important regional bodies that are really contributing to advocating for and increasing our knowledge on the provision of early childhood care and education. But we have some persistent, serious gaps to address as we move forward. So in some parts of our region, malnutrition rates are still very high. And this is related again to the issue of providing services for children who are in non-mainstream communities and who are very hard to access for reasons of geographical location or marginalization. And so these is, in terms of moving forward post-2015, and again, this is an argument that is made in the broader human development literature, and that is that, again, because of the nature of the Millennium Development Goals and the EFA targets, they were kind of conceptualized or set at a global level, fed down to regional and national levels, and then down to children and communities. And what we need to see more of, and what we have been seeing in the presentations today, presentations and discussions today, is that we are beginning to focus much more on what's happening at a community level in terms of what works, why, and how, and feeding that information up to the national and regional level, and subsequently to the global level. So again, it's important to note that this is not just an argument that's made in terms of early childhood care and education, but in terms of broader human development, but I think it's very relevant to us. Just a concrete example of one program that's worked this way in this region. In Vietnam a few years ago, they introduced mother tongue-based education, and it's been a very well-documented kind of experiment. And recently they have produced some very positive results related to the program. So the program is directly catering for children from ethnic minority groups who have been struggling with attainment in the mainstream education system because they don't speak the national language. And so during the preschool years and for the first 3 years of primary school, they learn in the traditional learning areas through their mother tongue, and they learn the national language as a second language. And then they transition into the kind of mainstream curriculum. The very exciting thing about these results is that they have been they've been pushed up to the national level, and they're now being talked about in terms of policy. And also I've seen discussions about I saw an article about it in the UK Guardian newspaper. So again, a really nice example of how a successful program that has been very well documented is now informing policy at the national level and above. And just a couple of less well-documented examples from the region that I feel very passionate about, actually, especially in terms of the aspiration post-2015 of putting people and place first. The first of these is from Vanuatu, which some of you may have heard has just suffered a terrible natural disaster, so we're thinking about them. But Vanuatu is rich in natural resources, but there is very little available in terms of financing for early childhood care and education. But they have a dynamic lady working in the Ministry of Education who has set up teacher training, early childhood teacher training, with very little in terms of financing. So the program lasts, the initial stage of the program only lasts for about 6 weeks, but during that time teachers are provided with basic theoretical and pedagogical foundational knowledge. And they're also taught how to build preschool structures within the community, working with community members. So building a community team to construct the preschools, and also how to make their own learning resources out of natural materials. And then the second program that I'd like to share with you very briefly, again, I'm not providing much of the detail, is from the Philippines, and it's affectionately called ECCD on Horse. This is a program that caters for children from very remote geographical communities. So these childcare workers travel to the communities on a rotational basis and set up in any community space and provide a playgroup program. Anecdotal evidence suggests that they've been successful in terms of engaging community. In some of the successful programs, community members have become involved in contributing to developing learning materials that reflect Indigenous values and include songs and stories. And also in some of the more successful communities, they've become entry points for health and welfare and other services. One of the difficulties with both these programs is that if we assess them according to international standards of quality, there are some real issues. The teacher training program in Vanuatu is very brief. There is follow-up, but it is brief. And in the Philippines, the ECCD on Horse program faces various challenges in terms of sometimes the childcare workers can't visit the communities very regularly. It happens on a rotational basis, so I guess the dosage is not very high. 0 minutes. Gosh, sorry. Sorry. Oh my gosh. Okay, right. I'm going to run through the rest of this. So my point is that as we move forward post-2015, we need to think very carefully that one of the proposed targets is that all girls and boys have access to at least 1 year of a high-quality preschool program. What do we mean by high quality? I think it has to be very carefully defined. And then just very briefly in terms of policy concerns with the region, I did a thematic analysis of documents that came out of a regional early childhood policy forum recently. And I'll very, very quickly say that I found this very interesting because a lot of the concerns that were being expressed this morning from our point of view are reflected at a country level as well. How do we deal with the huge diversity in this region? We speak 3,200 languages, we have very diverse ethnic groups, we have different religions, and these are concerns that are shared by countries as well. Engaging across stakeholder groups, making sure that clear messages are fed down from the national level to the district level and local levels. These are all issues that countries are dealing with as well. So we've got to do more in terms of addressing those issues. We've achieved so much. But in terms of addressing equity and sustainability gaps, I would argue that we really need to focus much more on finding out what works, why, and how at the community level, particularly when you were trying to provide services for children from non-mainstream populations. And I just wanted to end with the UN High Commissioner for Human Rights' quote. The Millennium Development Goals really encouraged us to treasure what we were measuring, and it's time now to kind of think about what we treasure and focus on measuring that. Thank you.
Thank you very much, Emma. Our next speaker is Professor Min Zhou from the Nanyang Technological University in Singapore and on leave from UCLA.
Thank you, Rindamar. Thank you so much for a very stimulating workshop. And I'm not a practitioner, and I also don't do intervention programs. And I'm a sociologist, and right now working more on immigrant children's adaptation So I hope what I contribute to the floor is to look at what Emma is pointing out, children and community, and what is in the community that could provide a context for helping children of immigrants to integrate. So my research really focused on children's education, as children's education is a critical and integral part of the integration project of any migrant receiving countries. So I would touch on very quickly on the challenges for educated immigrant children and how to connect immigrant families living in poor neighborhoods with the school to promote their educational achievement. And then I use the case of Chinatown and Koreatown in Los Angeles to illustrate the immigrant neighborhood and also the community context. So we know that raising children is challenging, period. And for immigrant children, especially immigrant children growing up in poor families, there are specific set of challenges. Like from the perspective of the immigrant families, and there are tremendous cultural and language barriers, and also poverty is a concern because poverty means, like if a family is poor, that means the neighborhood that the family live in is poor, and the school that the children attend is understaffed and also with limited resources. And the social environment is also non-conducive to educational attainment. And we have learned a lot about the achievement gap between middle-class Americans and also between middle-class Americans and working class Americans, as well as working class and poor Americans who are predominantly ethnic and racial minorities. And then in the neighborhood, we would experience a lot of economic disinvestment. That means big businesses are pulling out of the neighborhood, retail stores out of the neighborhood. So of the economic activities that are in the neighborhood, mostly are small businesses serving the survival needs of the families. And the neighborhood environment also experienced social disorganization. That is with the outgoing of the middle class, and a lot of the organizations that are there are either, there are very few of them, or of those who are there that play a very important role, they are severely underfunded and understaffed. And then there is also severe social isolation problem of the families that are living there. And schools, and we know that in a lot of inner city schools in America, in the one of the most advanced industrialized countries, the schools, the achievement rate is very low. Dropout rate is high. And even the minimum passing rate, you are counting some of the elementary schools, middle schools, and high schools, the passing rate is only a quarter. So that's a pretty severe problem. And here is, I present you with two typical immigrant communities that give you a glimpse of what the immigrant communities, poor immigrant communities are like. So one is Chinatown, and then you can see that both Chinatown and Koreatown, it's populated disproportionately by racial and ethnic members. And then if you are looking at the social-economic characteristics, these neighborhoods are predominantly foreign-born, that is immigrants, and then the high school dropout rate of adult immigrants, of adult residents living in this neighborhood is fairly high. And I have three columns. One is LA County. LA County is also a central city, so it doesn't represent middle America. And then high school dropout, medium income, poverty rate is very, very high. So, however, in the neighborhood is poor with very few resources. However, the infrastructure of an ethnic community, it really depends on the selectivity of the immigrant group. So it's not all ethnic communities are poor in terms of their strength of community. And also, immigrant neighborhoods are made up of multiple ethnic communities. Okay? So there are tangible and intangible resources that could be created in the immigrant community to benefit children's education. So we have a hypothesis, and that hypothesis is confirmed, that is, ethnic communities are unequal in terms of the way the capacity they generate resources. And one of the main reasons is immigrant selectivity of the group. For example, Asian groups like Chinese and Koreans, they are highly selected. So even though those group members live in the neighborhood is poor, but the group itself has resources that benefit the co-ethnic group. Whereas Latino immigrants, they are disproportionately negatively selected. That is, the ones who are coming in are disproportionately of low SES. So the ability for the immigrant community to generate resources compared to Asian group is very different. So there is a structural difference on arrival. So I need to run through this because I saw the sign that I only have a few minutes. So in the local neighborhood, we'll see that the local infrastructure is very similar in terms of types of organizations in a neighborhood. But, you know, if you go deep into it, these infrastructure pertain to specific ethnic community. So for example, in a neighborhood, we have public facilities benefiting children, like libraries, cultural centers, school playgrounds. Every neighborhood, you can see that. But some neighborhoods have more than other neighborhoods, right? And then you also have nonprofit organizations. So nonprofit organizations, they are community-based. They serve the local people. And then you have the local businesses and ethnic organizations and churches. And churches and ethnic organizations are operating more along the ethnic line. So if we are measuring the strength of an ethnic community, we can take a look at the kind of institutions that the community have access to. So if you have access to ethnic institutional resources, these ethnic institutional resources can enable you to tap onto public resources at a higher level, including school resources. And then there are tangible institutions that we can actually observe, and then also intangible resources. That is, in the immigrant community, you think about social isolation. However, some communities can organize in such a way that could alleviate social organization. That is, their organization is lined up in such a way that they could bring the middle class back to the community. So with the middle class input, then social isolation could be alleviated because interpersonal relations are happening in these organizations. And once the interethnic interpersonal relations can generate social capital, here we observe the social capital conducive to education. That is the information that is necessary to help immigrant families navigate through the school system. In the US, the school system is quite complicated. So I want to highlight the importance of the ethnic businesses in immigrant neighborhood. Now, for the Chinese and Koreans, their immigrant communities have a very high density and diversity of ethnic businesses, including professional services that's specifically geared towards children. So when we talk about children's services, a lot of times we have the notion of nonprofit organizations. Those organizations run after-school programs that are very effective. However, there are so few of them in the neighborhood, and also they only serve low-income families. So the middle-class families don't go to these organizations. Whereas if you have the private organizations, then a lot of the middle class would also come in. And this is very familiar to Hong Kong because a lot of the immigrants, they bring the after-school tutoring system from Asia to to the U.S. But the point is that they are operating it as also as a means of ethnic entrepreneurship, like when you operating a mom and pop stores. And some people say that, well, because of the demand from the immigrant community. But I would argue that with the supply, it could also stimulate demand. So Latino children, with the supply of all these institutions, if there is a bridge between the Asian community and Latino community, Latino families would also have a need to get into these after-school services. So I would not go deep into the ethnic system of supplementary education because I'm running out of time. So anybody who is familiar with the Tiger Mom situation, that is basically about this. So the children are pushed to achieve, and they have a lot of institutions in supporting them. And the point is, this is in a middle class, in a poor working class community. So these educational resources are very crucial because just dumping the children in school and expecting them to achieve is not realistic. You have to have extra help. And nonprofit organizations, they also run these programs. But their programs, one is the quality of it, the other is the outreach to the people is very limited. So they have after-school tutoring, preview, review of regular school curriculum. They have college prep services. And then they also have academic enrichment. So some people think that Asians are bookworms, but they are not, because they know that getting into good universities, you have to look good on your application. And look good on your applications, you have to be provided opportunities, say volunteering, doing stuff that are non-academic. So they also have a range of services that deal with this need. So to conclude, my study and other study in the immigrant communities shows that when we look at an immigrant community, a neighborhood it doesn't equal an ethnic community. It has multiple ethnic communities. So in a way, even though we face challenges of educating poor children in poor communities and public resources are limited, but there are opportunities in the neighborhood. But how do we help the non-co-ethnic groups, say in the Chinatown and Koreatown situation, how to help the Latino families tap into the Asian community's resources. So that is one of the policy recommendation that we have. So our conceptual model basically is integration is measured by educational achievement. And so we have three contexts. One is family, the other is school context for promoting educational achievement. Either one of them are not enough. We need the community context to help bridge the family and the school to promote children's education. And what I was saying, all these, the middle class are doing all that. Middle class America, they are doing all that. But in the working class community, there is a need for community, for attention to pay in helping these communities do. So I would not occupy more time. So there are three policy implications. One is promoting entrepreneurship. The other is promoting partnership between nonprofit and local businesses. And the third one is breaking the boundaries to open up existing local resources that are ethnically bound to benefit our group members. Thank you.
Thank you very much. Our next speaker is Dr. Najma Sheikh from Kathimpolo in South Africa.
Okay, thank you for inviting us to this forum. We really appreciate the opportunity to present our program in South Africa. So I'd really like to thank the forum members and the organizing committee for having facilitated us despite a very short notice. Nonetheless, I wish to also say that we are entering the graveyard session, so we'll be shifting gear a little and go down to implementation level. So I will be sharing with you an NGO experience, and I'll tell you more about our organization later as we go along, but to show you or demonstrate a ground level experience. I'm going to skip the slide because I have been told that I've got more than 10. It's just an overview. So let's begin with the landscape of ECD in South Africa. So basically in South Africa, of 19 million children, 60% of children live below the poverty line. And this is staggering in terms of sheer numbers. In terms of ECD access, children under the age of 4, over 70% do not have access to center-based services. The question is, we do have an ECD policy, an integrated one, and why is this not happening? Well, the government has committed since 1994, since our democracy, by increasing the funding, as you can see in the graph below. There has been a significant increase in the funding. However, the coverage has been poor. That means that poor children, and this funding was targeted at poor children, children in quintile 1 and 2. The national coverage sits at 16%, and it ranges between 8% to 40% across provinces. So the poorer provinces would have a coverage of poor children receiving ECD subsidy at 8%. Just out of interest, the value of the subsidy is $1.5 a day for 264 days, which is minimal. So the question is, why is there such an inequitable distribution of these services? And what are the barriers to access these services if the funding has increased and there hasn't been this kind of delivery? In my opinion, I will argue with the facts below that there are many and varied, and they're not unique to South Africa. We've heard these earlier today and yesterday, but let's go through the facts. The facts are that the central blocking factor in terms of accessing these ECD subsidies from government is that the criteria is that the funding will be targeted to a registered ECD facility. These services are provided by private sectors, informal sectors, NGOs, a whole plethora of service providers. And in order to register, you need facilities, you need staffing, and you need the ability to navigate through 16 steps through the national government to be able to register your facilities. So, and therefore, we find that it is not pro-poor, because areas where there is poor coverage, where there are no facilities, there are no ECD paraprofessionals, they will simply not be able to tap those resources. In terms of the funding, it's also channeled through the provincial level, and when national government allocates the money to the provincial level, it's not mandatory to use the money for ECD. So often they would channel the money for other statutory requirements, such as rape, domestic violence, securing children for safety, and more often ECD would slip along the priority. The finance itself at 1 billion rands a year is also not enough, considering the estimates. It is estimated that we need 5 million to cover the children who need care. So all in all, it is not a pro-poor delivery model, okay? And the gap then is for the NGOs to step in. And Kathy Mpilo, being an NGO, had stepped in a very convoluted manner, and I'm going to give you the background. Now, Kathy Mpilo means Choose Life, and it is an organization that provides HIV treatment, care, and support to communities where there is complete state failure at multiple levels in terms of infrastructure, staffing, and delivery of services. So where there is state failure, Kathy Mpilo would go in, build clinics, staff the clinics, deliver the service, and in a few years' time, we transition the service back to the state with our staff, back transition to the state. And then we continue to do technical support. So there is a phased approach to it. And Kathy Mpilo has been doing it for over 10 years, and we provide ARV treatment for about 250,000 people. It's 10% of the country's cohort of people on ARV. So it's fairly large scale. Some of the innovative models that came out of delivering such a large-scale program in terms of resources being limited was the introduction, I can't believe it, it's already 5 minutes, I'm going to rush, was the introduction of community workers that we had heard about. But these were paid community workers. They had been skilled by Kathy Mpilo to become patient attendants, social auxiliary workers who went through national qualification levels and certificates, and they were paid. And through the program, they sort of formed a connection with the household so that adherence was improved, households, health, safety, a whole range of socioeconomic issues were also strengthened and addressed. And through this program, we realized that in order to improve the outcomes of children in our care, we needed to provide ECD services because many of these children, HIV-affected households, were not accessing any form of ECD. So we initiated a program. We trained up our social auxiliary workers for 1 year of training, and we developed a model that was home-based. Here I present to you a POND, which is a home model, a cross-section. So at a household level, we have a social auxiliary worker who has been trained as a paraprofessional ECD worker, and she has 5 caregivers, or he. Caregivers are usually mothers, but not always the case in South Africa because there are orphan households, parents go and work as migrant workers. Often the grandmother is in charge, or it may be a neighbor or a friend or an aunt. So we call them caregivers in this respect. So they are the primary caregivers of the child. So mothers would meet on a weekly basis in a household, and they would rotate almost like a book club. So every week, one household would host. And what would happen are 4 components: teaching them parenting skills, doing a home visit of that household, where you screen the household for other socioeconomic needs, observe the child in the household, and also teach parents or caregivers how to stimulate the children, and then run a little play group as well in terms of ECD. And all of that with Kathy Mpilo's model would sort of dovetail to provide an intersectoral service provision because with our ARV model, it's very intersectoral. So they would act as point persons to channel people to the relevant services where necessary. So yeah, I'm going to rush through these outcomes, but essentially using the mother-child interaction scales, we saw a significant improvement pre and post, particularly around children being taught how to identify animals, the way in which children are punished, where reduction of physical punishment and so on. In terms of the caregiver coping, they reported from baseline that they had felt more empowered because part of the program also targets the caregiver in terms of their own health and well-being. And we saw an improvement. At a household level, we saw children starting to wash their hands. Children, water was stored in a safe manner because remembering many of these households do not have pipe water systems and they don't have adequate water and sanitation. So there is improvisation that takes place. An interesting fact was those who had not known the HIV status were worse off at baseline, and we see them as a proxy of the most marginalized because they hadn't accessed any form of service previously to be able to give them the opportunity for possible testing and so on. However, we saw a significant improvement amongst this group, highlighting that those that were most marginalized were most likely to improve considerably. In terms of the outcomes, in terms of intersectoral, we saw people access grants and certificates. We access social protection. Close to our heart would be increased uptake of HIV testing and counseling. And those are all factors that are the gateway for HIV treatment care and support. So we saw this wonderful transition in terms of accessing other services. So how did we do it? In terms of, we developed a system of having imbizos or gatherings, and we would bring in all the sectors in 2 days in a hall, blitz to the entire community, all the households and the neighbors, that they would be arriving. So we'd have agriculture providing seeds where necessary, home affairs coming with registration documents, and they would be processed on the day, primary healthcare nurses coming to screen, test, immunize, and so on. So entire households will be screened in 2 days. in terms of creating a cadre of workers from unemployed workers with matric or with post grade 12 certification have been trained up to become social auxiliary workers who have been trained up to be ECD professionals, and they can be fully be employed as such. In terms of the policy framework, as I said to you, there's a complete lack of accountability and budgetary framework that actually caters for home-based ECD. There is no money that comes directly from government to non-center-based ECD services. In terms of design and implementation, we adapted to the context. Some of these households are highly deprived, and grandmothers using traditional methods of child rearing. So we adapted the curriculum, the context in terms of toys, upcycling elements. As you can see in the photograph there, we had fathers getting involved in making these toys. And that was the way in which we designed. In terms of quality, always at the back of one's mind, that one should not compromise on the dose and the ratios. And all in all, it's not the cheapest program, but we felt that we couldn't compromise in the dose and the ratio. So in terms of measurement and metrics, we found that the most important thing that really came to the fore was that about 1 in every 4 children was wasted and was stunting. And we realized that we needed to do better anthropometric measures because they were not recorded very well in the Road to Health cards. And we have begun to track that. Tracking children and families intergenerationally through intersectoral pathways is difficult. Developing an ID that allows you to do it. In terms of tracking the pipeline effects for schooling, we are still in the process of doing that. Moving from innovation to scale up is hard, especially when funding cycles are short and you cannot show impact. Transitioning from donor to state is even more challenging, as we have seen with the ARV program, but it can be done. Finally, in terms of the fiscal funding streams, there are no dedicated funds at this moment for non-center-based services, so there is a need to do that. So in conclusion, we have seen through our learnings that it is possible to provide and send a home-based ECD service, and there is a potential for for households to benefit from it. However, we do not see this as a permanent solution. In the short term, the KI mantra is always transition, and we will not scale up. It is not within our agenda to scale up, but to transition and strengthen the state. So we believe that we are happy, like many other NGOs, to transition and assist the state in being able to provide this kind of service in a constructive manner. We have done this with the ARV program with ring fencing funding at a central level. And this can be done for ECD provided there's political commitment and there's sufficient advocacy for such a program. Finally, in our vision, we see as a long-term effect, and we've heard very eloquent discussions this morning, cooperative governance, cooperative work, intersectoral. Not sure if it's going to be integrated, but we have this vision that it will be in the end. So I shall leave you with the words of our father of the nation, who said, there can be no keener revelation of a society's soul than the way in which it treats its children. And I think this is something that as South Africans we should always remind ourselves where we are and where we have come from. So I think just to take the children of the future into the next generation that are healthy is our critical challenge. I thank you for your attention.
Our 3 speakers, Min, Emma, and Najma, to come up, please. We kind of ran a little late, but we do have time for a few questions. But before I open the questions to the audience, I would like to see if there are any online questions. We have a couple of members of the forum, Peter Singer and Lorraine Scher, online. Do they have any questions for us? Okay, we'll wait to hear from them. Because we are running a little late, maybe I can ask for questions. We'll take a few questions at a time, and then I'll ask our panel to, members of our panel to respond.
Very much. I think once we get into these complex issues of implementation, the range of what needs to be covered gets larger and larger. But thank you very much for that conversation. Min, I was very intrigued by the idea of local sort of entrepreneurship and local businesses for early childhood. I think that typically this is not a group that is considered in our repertoire or landscape when we look at how we can provide services for children. So my question is that I know that the examples presented were from the United States. What relevance do you see for that, or applicability to cities that are being rapidly urbanized, where the immigrants may not be from a different country, but maybe more sort of rural immigrants moving into more urban areas, and what role these local businesses could play in that?
Thanks to all the panelists. Those were excellent presentations. And mine is a follow-up also to Min about, I was really intrigued actually by the discussion of resources that are particular to one group and how those might become accessible to another group. And just wanted you to talk about in a multicultural setting, wherever that may be, there might be some barriers to that sort of cross-fertilization or making those resources available, and what might be some possible ways to do that?
Okay, thank you for all the three wonderful presentation. Maybe I just keep one question, all right? And maybe more to the immigrants. And now within one ethnic group, they even say Chinese, is within that group there's a lot of cultural diversity. And it's less homogeneous than before. But how then we could meet the needs, let's say, well, even a big group like Chinese or Korean, or even within the group, the cultural diversity, and coming from different part of the country, and they may have a different needs. And so maybe like the panelists enlighten further.
Min, seems that the questions are related to your talk, so perhaps you can address them.
Very good questions. And those are the questions that I have been trying to wrestle myself too. The role of local businesses, you are right that a lot of the times public policy does not pay attention to the role of small businesses in the educational arena, both preschool education, after school, and it's a lot of the times it's leaving to the hands of nonprofits and also the public resources support. From what we found that there is a great need, and yet, businesses, they are running businesses responding to a need. But educational need is an urgent need in many immigrant families, regardless of your ethnicity. But running businesses is not easy, right? So people go the traditional route. And for the Asian immigrants, they have, this way of transferring their practices from their homeland to the host land. So one way of promoting small businesses is to promote small businesses in the educational arena. And that is not just relevant to the US. I think to other countries as well. So it's more of a conceptual shift in the understanding of entrepreneurship. And that's one. And then the resources that are ethnic is very exclusive, you're right. And it's very challenging to make it open to other non-co-ethnic members because of the language and cultural barrier there. But things can be done. For example, a lot of our cultural centers in the community run by nonprofit, if they are working closely with the church is a very important ethnic organization in the neighborhood, even though the church are non-exclusive, but the way they operate is also along the ethnic line. So if nonprofits working with the church, and then because local businesses, they also are members of the church as well. So that way, there is a way to break through. And as a matter of fact, from Koreatown, they are doing a lot. The Korean churches are doing a lot in making that bridge, even though the results is still much to be desired. And then the intra-diversity of the group, right? Any immigrant groups is very diverse, like the Chinese. Koreans are less diverse than the Chinese. But for the Chinese immigrants going to a place, if you are middle class, to some extent, you can afford to assert your different identity. But for the working class, you don't have much choice. And you all, like if you are Chinese, coming from Cambodia, coming from Vietnam, coming from China, you all become Chinese in Chinatown that way. But if you are middle class, then you tend to assert, because middle class have greater resources and grounding in asserting their ethnicity, whereas working class, they have to depend on whatever resources they have. And the ethnic community is one of the key institutions that are serving them. So they have to subsume their whatever regional identities to a common ethnic Chinese identity.
Thank you. Thank you. This is a question that's come from online for you, Chima. Okay. How difficult, and it's from Lorraine Shear, how difficult is it to get government on board for ECD support? What are the major barriers? What are the major barriers, and have you seen progress? Okay.
All right. In terms of the support, there is at a policy level an integrated policy. I think the barrier is unlocking the funds, I think in a structured manner. At this point, it prevents tapping in resources of communities that are poor and that have less resources. We've had this dialogue with government more recently, particularly with social development, and we've actually been asked to go into phase 2 in relation with government, where we're going to be testing out different models and providing them the evidence on how best to unlock this through the center-based, non-center-based services. So clearly it's a journey. It's a journey of us working collectively, but also a case of the current fiscal streams don't allow for it. And I think at some point government will have to revise that process and make it mandatory at a provincial level to actually spend the money that has been allocated and hold provincial officers accountable for the lack of spending. And I think we've done that with other programs. There is a commitment, but now it needs to be translated into action. And I think we hope that we can get there. Thank you.
Okay, do we have any more questions? No. Any more online questions? Well, I think please join me in thanking our 3 speakers on giving very wonderful presentations. Thank you very much. And I have the pleasure of introducing the moderator of our next session,